Hello and welcome to Challenge Channel. Hello and welcome to Challenge Channel. Today we are going to discuss GIT system or gastrointestinal tract. We start with esophagus, and the first disease in esophagus is actually GERD, which is gastroesophageal reflux disease. The definition is actually the reflux of gastric content to the esophagus, causing severe symptom affecting life or complication. So, if there is no severe symptom that affect life or any complication, this is called reflux. The risk factor of disease, there is a lot of risk factor like pregnancy, obesity, fat intake, chocolate, blah blah blah, a lot of risk factor. But I want to mention something important here, that the patient with achalasia, when we give him treatment like calcium channel blocker, this can cause GERD because this treatment lead to relaxation of the lower esophageal sphincter, which can finally lead to GERD. We can see the rest of the risk factor here. So the clinical presentation, patient have esophageal symptom and extraesophageal symptom. The esophageal symptom is actually heartburn, regurgitation, water brash, and sore throat. The heart pain have a character which increase by bending forward and after a meal, and relief or decrease by antacid. Regurgitation is due to relaxation of lower esophageal sphincter. Water brash is actually due to irritation of the salivary gland by acid, which lead to secretion of saliva. This is called water brash. Also, patients have a sore throat due to irritation of the throat by acid. The extraesophageal symptoms are asthma. We have a rule here. Any patient who has persistent asthma, we give patient all treatment. Despite of that, the patient show no improvement. So, in this case, you should put in your mind GERD as a cause of asthma. Hoarseness of voice due to laryngitis, teeth decay, chronic bronchitis and cough, and chronic sinusitis, all of these are extraesophageal symptoms of GERD. The diagnosis, gold standard for diagnosis of GERD is by 24 hours pH monitoring. Also, we can use PPI administration as a way of diagnosis. This way of diagnosis is called therapeutic diagnosis. We give patient treatment. If show improvements, that's it. That means the patient have disease. Also, PPI can use in treatment as we see later on. The complication of GERD is actually reflux oesophagitis, which appear clinically as odynophagia, Peptic stricture due to fibrosis, which appear clinically as dysphagia, Barrett's esophagus, which can finally lead to adenocarcinoma. We will mention Barrett's esophagus later on. Then we come to the management. We start with lifestyle modification like small frequent meal, no late meal, bed elevation, weight loss, avoid drug and meals that increase GERD like alcohol, cigarette smoking, chocolate, fatty meal, blah blah blah. You should avoid all of these. So, medical treatment, we give patient antacid or PPI. Actually, PPI is the first line of treatment, and about 95% of patients with GERD show great improvement after giving him PPI. A surgical treatment will do a Nissen fundoplication, but it's rarely done nowadays. We just give patient PPI. Important note here, treatment of H.pylori is not effective in patient with GERD. The meaning of that, if the patient have GERD, you shouldn't give him treatment for H.pylori because the treatment of H.pylori does not tighten the lower esophageal sphincter. That's it for today's lesson. If you have any questions, please let me know. Thanks for watching. Don't forget to like this video and subscribe to our channel in order to get more and more free videos on the time of production.